Next, we're very pleased to introduce Alan Brookhart, who will be talking about the effective social distance policies in North Carolina. Dr. Brookhart is a professor here at Duke, and also the chief scientist and founder of NoviSci. So, Dr. Brookhart, yes, we can see your screen.
Yeah, can you hear me?
Yes, we can.
Okay, great. Well, good morning, everyone. Thank you for inviting me, Michael, to participate in this symposium. So I'm an epidemiologist and biostatistician in the Department of Population Health Sciences at Duke. I've been working since March with an informal consortium of researchers studying the epidemic in the state with the aim of supporting the state's policymaking. We have been building models of the epidemic, trying to estimate the risk of hospitals being overwhelmed, and also trying to understand how various social distancing policies may affect the trajectory of the epidemic in the state. I've not been doing the modeling myself, but have been analyzing, studying the state reporting data. So I'm going to talk about a retrospective sort of assessment of how the various social distancing policies enacted by the state affected disease transmission within the state. So in particular, we're looking here at how policies affected the so-called reproductive number, RT, of the epidemic. So this is a measure of disease transmission, and it can be interpreted as the expected number of new cases generated by each infected individual at a given point in time. So at the start of the epidemic, this is called R0 or R0. So if this is greater than 1, the epidemic will be expected to increase in size. If it's less than 1, it will die out. And so this is not an inherent characteristic of the disease, but is affected by contact rates in the population. So more crowded environments will have higher reproductive numbers. It also is affected by whether or not a given contact will result in a transmission. So mask wearing, for example, will reduce the reproductive number. It's also affected by immunity levels in the population. So there are a lot of estimates of R0 out there in the literature, and there are websites that report on estimates of the reproductive number at the state level. Most of these are based on dates of reporting when cases get reported to local health departments. This date is not proximal necessarily to the actual date of infection. That is what we care about if we want to look at kind of timing and how transmission changes over time. So it turns out that in the state reporting data, in many of the reports we get symptom onset. So the date of symptom onset is reported in about half of the cases, and also date of testing. And so this gives us the opportunity to really get at the actual date of infection. So if we're willing to make some assumption about the incubation period of the disease, and there's a lot of data on this now, if we know when symptoms began for a patient, we can make an estimate of when they actually contracted the disease. So in some cases, as I mentioned, about half of the reports, the time from the date of symptom onset is missing. So we can estimate the typical time between symptom onset and testing from the observed data. It's about 3.5 days. So if we only have date of testing, we can still get an estimate of the date of infection. So for our assessment of R0, we assumed an incubation period of 5 days. We used 3.5 days as the time between symptoms to testing if symptom onset was missing. We assumed a duration of infectiousness of 11 days. We assumed that 2 of these days occurred occurred during the incubation period. So from these assumptions and the state reporting data, we can estimate a daily incidence of new infections in the state. And further, we can estimate how many patients at a given point in time are likely still infectious. So from these two numbers, we can estimate a daily transmission rate. And then this can be rescaled using the duration of infectiousness to provide an estimate of the reproductive number of the disease and confidence intervals on any particular day. So what we see from the state data is the following. So in this graph, each red dot represents an estimate of RT, of the reproductive number on a particular day. So we have this divided up by the various policy periods. So before there are any policies enacted, it appeared that the reproductive number in the state was a little over 2, about 2.1. I should also mention that we removed from the numerator of these calculations cases that arose from travel. So we're just kind of looking at cases that presumably arose from internal transmission dynamics within the state. Of course, those travel-related cases contributed to the pool of prevalent patients in the state. After the school closure on March 14th, the reproductive number dropped. It was very close to 1, and it remained very low. It has remained low, so it increased slightly actually after the stay-at-home order, but it's only increased modestly after after the phase 1 reopening on May 8th and the phase 2 reopening on May 22nd. I was nervous that we would see an explosion of cases after the phase 2 reopening. That hasn't yet happened. Nevertheless, the reproductive number is still above 1, so the epidemic is growing in the state, and that's something definitely to keep an eye on. So one thing I'll note here is that these estimates could be biased by the change in testing practices within the state. So we're obviously testing more now, so we are potentially detecting more cases that wouldn't have been detected earlier when patients may have been told to self-quarantine as opposed to come in for testing. So we're continuing to refine this analysis, and we'll do sensitivity analysis to understand how changes in testing and other changes in the epidemic parameters might affect these estimates. So I'll stop here.
Dr. Brookhart, thank you very much.
Alan, I really like it, and I think the R number is such a nice, simple statistic to present. I think, as you're pointing out, it's not so simple to calculate, and there are a lot of assumptions going on. The question on my mind, right, June 26th, Friday, is the day of decision whether we move on to another phase of reopening. And we have the R number creeping up slightly, but as you said, the infection is still growing. So would you tell Governor Cooper to move on to the next phase, stop, go back?
Well, I am personally concerned. I would like to see this closer to closer to 1 or below 1. So for me, these numbers are concerning. Unfortunately, we can only compute this reproductive number. We can't get it today. It's about 10 days lagged, given the way we're calculating it. So I'm not sure what's going on today. I'd like to see more data, but there is a worrying trend here, and there, as we all know, there's also an increasing number of patients hospitalized currently.
Wonderful, thank you.